My name is Maury Gertz. I'm chair of the Department of Medicine at Mayo Clinic, Minnesota. I'm also a member of the myeloma team at Mayo Clinic, led by Dr. S. Vincent Rajkumar. Multiple myeloma causes anemia, low blood, which results in fatigue, apathy, loss of energy. It can cause damage to bones, particularly the back and the ribs, which can lead to unexplained back or rib pain. And occasionally it can cause damage to the kidneys because of proteins that the cancerous cells in this bone marrow cancer produce. Multiple myeloma is a rare cancer, and it only accounts for 1% of all cancers. So most practicing oncologists see a very few number of patients in their practice. At Mayo, we've had a 50-year interest in this disease and have built an enormous knowledge base, understanding and pushing the envelope for effective therapies for this disease. The reason why Mayo Clinic excels in this area is because the large number of patients we see allows us to arrange contractual agreements with biotechnology firms as well as the National Cancer Institute that provides us access to new effective agents and new combinations that are not available in the community. Just as important, the care of multiple myeloma requires an integrated approach. So not only do we have highly experienced hematologists to care for the disease, we also have myeloma experts in the field of kidney disease that can take care of these kidney problems. We partner with orthopedic surgeons that specialize in multiple myeloma bone disease. We integrate with interventional radiologists to help rebuild the bone. There is an endocrinologist in our group who specializes in multiple myeloma bone disease and understanding the pathophysiology, the causes of this problem. We are able to attack the multiple myeloma not only from the chemotherapy standpoint, but we can tap the resources of experts in multiple other disciplines to arrive at an integrated treatment plan that we've all agreed upon to ensure the optimal outcome. In multiple myeloma, Mayo Clinic has a 20-year experience using stem cell transplant, which is regularly applied for the treatment of patients with multiple myeloma. Unlike other centers, bone marrow transplant for multiple myeloma is an outpatient procedure. Hospitalization is not planned, and our outcomes are the best in the country in terms of our complication rate. We have a system with experienced nurses and a team built with nurse practitioners and physician's assistants who are aware of all the research opportunities, the clinical expertise to ensure that our myeloma patients get the best possible care that they can get to deal with this rare, often frustrating and confusing disorder. At Mayo Clinic, our primary value is that the needs of the patient come first. This cannot be any truer than in our multiple myeloma group, where our primary goal is to ensure the best possible care for each patient without regard to research aspects, educational aspects. We want to ensure that patients get the best possible outcome that is achievable with multiple myeloma now and going into the future.